Michelle, and I'm the Epic Lead for Shared Support in SDA apartments. A decade ago, Summer pioneered the 10+1 model of housing. It was designed to allow people who require 24/7 support to live with high levels of independence in well-located apartments. Each tenant lives in their own apartment, with the additional +1 apartment housing the shared on-site support team, also known as OSS. They're there around the clock to offer assistance when required without needing continuous one-to-one support in every apartment. Since inception, the model has grown to hundreds of sites across the country. So a decade in, it's timely to explore what's working well, what could be improved, and what needs to evolve. Summer has already done extensive research and co-design in this space. More than 200 in-depth interviews and outcome measurement with hundreds of people moving into SDA apartments to understand how the model is working in people's lives. That includes tenants at one of the first apartment sites in Abbotsford, which is pictured here. The apartments are well located, they're close to public transport, cafes, shops and services. In today's presentation, I'm going to focus on how some of these pain points we're seeing from participants intersect with the market dynamics and the operating challenges of the model, drawing on recent engagement with dozens of providers about the barriers and the opportunities to evolving shared support. Over the last decade, the SDA apartment market has grown significantly. And with that growth has come some challenges. As more apartments have been enrolled, some tenants have moved to new sites. And at the same time, SDA funding has become harder to secure from the NDIA. And that's leaving some sites with high vacancy rates. The 10+1 model was originally developed on the assumption that support would be shared by 10 tenants. In reality, many sites that have been developed are smaller, such as 6+1, or are only partially occupied. In sites where fewer than 8 participants are opted in or contributing for the shared support, providers are likely operating at a loss. Given the need to staff 24/7, the on-site support model has a largely fixed cost base, so regardless of whether 3 or 10 tenants are contributing. So that in turn creates some real viability challenges for providers, which are already operating under small margins. OSS itself is mostly focused on short functional tasks. Things like help to go to the bathroom, making a cup of tea, adjusting a headrest, or picking up a dropped iPad, and being there when something unexpected happens. Over the past few years, many participants have opted out of shared support. For some, they didn't feel that they were getting great value from the service, or others didn't have adequate funding or were not satisfied with the quality and the responsiveness of the support. And this is at the core of the tension. Providers need to deliver a collective, pooled model for tenants who each have individual needs, preferences, and plans. Balancing choice and control with the reality of a shared support service is not simple. For many people, moving into an apartment on their own is a huge life transition, and it can be really lonely. Building new routines, relationships, confidence, it all takes time. Many tenants haven't yet created the meaningful community connections that the model originally envisions, and as a result, are still using high levels of one-to-one support. We've begun to think more deeply about what community connection and social capital beyond paid support could look like, especially in those first couple of years after the move. Despite the operating pressures, there are green shoots of innovation happening right across the sector. Providers are trialling new models that adapt to different occupancies and different tenants mixes, and they're responding more flexibly to tenants' needs. There's also been a genuine openness to collaborate, to learn from each other, and seeing on-site support in action still reinforces what's possible when housing and support are designed really deliberately and meaningfully together with tenants at the centre. Despite the complexity of operating the model, every provider we've interviewed is deeply committed to making it work. The on-site support model pushes them in a really good way to think differently about how support can be delivered, giving independence, flexibility and agency to tenants. We've also seen examples of providers delivering data-driven operating models that focus on continuous improvement and learning, and demonstrating how we can deliver both exceptional participant outcomes that are measurable and affordable to the government. And this matters because with the right guidance, we believe that SDA apartments can deliver a wonderful quality of life for people who do want to live independently, while still being cost effective for the NDIA. So to get there, we're going to need to reimagine an evolved model of shared support, one that balances the needs of the collective with the choice and control of the individual, and that delivers clear value to tenants while being sustainable to deliver. We're really excited to keep collaborating with deeply engaged and values-driven providers, and to really challenge ourselves to think about how we design a new model of shared support. One that adapts to different sites, to different tenants mixes, that responds to participants' changing needs, and delivers exceptional outcomes to all stakeholders, including the NDIA. Through this project, it's become very clear to me that when this model works well, it delivers exceptional quality of life and independence for participants. And we're really looking forward to continuing to work on this ethic. Thank you.